All right, let's jump right in. Today, we're talking about Sjogren syndrome. It's one of those conditions that affects millions of people, but honestly, it's so often misunderstood. So you hear dry eyes, dry mouth, and you think, sounds pretty simple, right? Maybe a minor annoyance. But what if I told you that behind that simple complaint could be a serious autoimmune disease, one that even carries a risk of lymphoma? That's the real story of Sjogren's, these seemingly small problems that are actually just the tip of a much, much bigger iceberg. Okay, so let's get real for a second and talk about what it's actually like to live with this. Because, yeah, dryness is the big headline, but the day-to-day experience for patients, well, it's a whole different ballgame. And this right here, this is fascinating. You'd think the number one complaint would be dryness, right? But look at this. When you actually ask patients what impacts their life the most, a whopping 79% say it's the fatigue. That's right, more people point to crushing fatigue than to the dry eyes or dry mouth. Then you layer on chronic joint pain and trouble sleeping, and you start to see why calling this just a dryness thing is a massive understatement. So what in the world is going on inside the body to cause all this chaos? Well, the best way to think about it is like a civil war. Your body's security system, the immune system, totally gets its wires crossed. Instead of protecting you, it starts attacking you. And here's the official term for it. It's an autoimmune disease. It's a classic case of friendly fire. Your immune system, which is designed to be this amazing bodyguard fighting off germs, gets completely confused. It looks at your own healthy cells and thinks, hey, you're the enemy, and just launches an all-out assault. Now, in Sjogren's, the immune system has some very specific targets, the glands that make moisture. So when it goes after the lacrimal glands, the ones that make your tears, you get that awful, gritty, burning feeling in your eyes. And when it attacks your salivary glands, bam, you get that intense, dry mouth that makes it hard to swallow and can even wreck your teeth. Okay, so who is most likely to get this? Well, there's a massive clue, and it's all in this one simple ratio, 9-to-1. What does that mean? It means that an unbelievable 90% of people with Sjogren's are women. Just look at that chart. It's incredibly skewed. This is a huge classic red flag for doctors. If a middle-aged woman comes in with these symptoms, Sjogren's has to be on the list. It's one of the most lopsided gender splits you'll see in any autoimmune condition. All right, so we know what it is and who it usually affects. Let's talk about the classic warning signs, the clues that both patients and their doctors really need to be on the lookout for. Honestly, if there's one phrase to take away from all this, it's this: dryness everywhere. That really sums it up. We're not talking about just needing a sip of water. This is a deep, persistent lack of moisture that can affect pretty much the whole body. In the clinic, this dryness everywhere feeling usually shows up as what we call a classic triad. 3 main symptoms. First, you've got those super dry, gritty eyes. Second, a mouth so dry it's hard to even talk or eat. And third, you might even see swollen salivary glands, kind of like chipmunk cheeks, right around the jaw. But here's the kicker. The attack doesn't just stop with the moisture glands. Nope, Sjogren's is what we call a systemic disease, which is just a fancy way of saying it can mess with your entire body. This is where that bone-crushing fatigue comes back in, along with chronic pain, that frustrating brain fog, and even dryness on your skin and, well, other places too. You can probably imagine, with all these different and sometimes kind of vague symptoms, getting a diagnosis isn't always a straight line. It really is like a piece of detective work. Doctors have to gather a bunch of different clues and put them all together to crack the case. And the key thing to know is there's no one single magic test for this. It's a journey. It starts with just talking about symptoms, then moves on to actually measuring the dryness, then to blood tests, looking for specific culprits, and sometimes it ends with a small lip biopsy to get the final definitive answer. So you might be wondering, how on earth do you measure dryness? It sounds weird, but it's pretty clever. For the eyes, they use something called the Schirmer test. It's basically a little strip of paper that shows how many tears you're making. For the mouth, they can literally measure your saliva flow. What's cool is that these tests take someone's feeling, I feel dry, and turn it into cold, hard data. Okay, on to the blood work. Here, doctors are hunting for specific autoantibodies. Think of them as the fingerprints of the rogue immune cells. The 2 big ones for Sjogren's are called anti-Ro and anti-Law. And hey, if you're a med student tuning in, listen up. Put a big star next to those two in your notes. They are guaranteed exam favorites for sure. So managing the dryness and the fatigue is a huge part of the battle, absolutely. But there's another layer to this, a much more serious risk that comes with Sjogren's. And this is the one complication that everyone, patients and doctors, has to be watching for. So let me ask you directly, almost like a test question. What is the single biggest, most serious complication we worry about with Sjogren's syndrome? The answer is non-Hodgkin lymphoma. It's a type of cancer that starts in your lymphatic system, which ironically is a huge part of your immune system. And the risk is definitely not trivial. We're talking about roughly 5% of patients with Sjogren's who will go on to develop this. But why does this happen? Well, think about it. The immune system is in constant overdrive, it's chronically inflamed, and over a long period of time, that constant state of high alert can actually cause some of those immune cells to become cancerous. So that brings us to the all-important topic of management. Because this is a lifelong thing, the game plan isn't about a quick fix. It's all about being proactive, controlling the symptoms day to day, heading off those big complications, and just maintaining the best possible quality of life. And it's really important to be upfront about this. Right now, there is no cure for Sjogren's. So the whole goal of treatment is what we call symptomatic. It means we're focused on managing every issue the disease throws at you and trying to prevent those more serious problems from ever starting. This breakdown gives you a great look at the toolkit for managing Sjogren's day to day. For the eyes, you're looking at things like artificial tears or even tiny plugs that help keep your natural tears around longer. For the mouth, there are saliva substitutes, special gums, and even prescription meds to boost saliva production. And this is huge. Because a dry mouth is basically a party for bacteria, super diligent dental care is an absolute must. Then for the joint pain, many people start with regular over-the-counter anti-inflammatories. And that really brings us to the final big picture question. Sjogren's is so often called an invisible illness. You can look at someone and have no idea they're dealing with this level of pain and fatigue on the inside. So that leaves us with this thought. With millions of people living with this, what can we do to shine a light on it? How do we make this invisible illness visible so that everyone affected can get the diagnosis, the support, and frankly, the understanding they absolutely deserve?